Welcome, everyone, to this special event, Get to Know California's Independent Living Centers. I'm Marley Benefiel, manager at Parents Helping Parents. PHP, as we like to call it, is located in Silicon Valley, and we are a resource center for people raising children and adults with special needs. We work with thousands of parents every year on education rights, accessing public benefits, and many more things. Nearly all of our staff are raising children with special needs. I'm going to learn alongside you tonight about the mission and programs provided by the California Independent Living Centers. I'm really pleased to be joined by three subject experts. Sherry Burns, who's the Executive Director at Silicon Valley Independent Living Center in San Jose. Lisa Samaro, who works with Sherry as an ILS coordinator. And Christina Mills, Executive Director at California Foundation for Independent Living Centers in Sacramento. In a minute, I'm going to turn things over to Sherry and Lisa, who will give us their overview. Then Christina is going to add a few thoughts. And for the last 25 to 30 minutes, we'll answer your questions. So let's get started. Welcome, Sherry and Lisa.
Good evening. I'll let Lisa begin sharing the screen here with our slides. Wonderful. Thank you, Lisa. As Marley shared, my name is Sherry Burns, and I'm the Executive Director at Silicon Valley Independent Living Center, or SVILC for short. My pronouns are she and her. With me tonight is Lisa Samaro, who is our Independent Living Skills Coordinator. And a big thank you to PHP for inviting us here tonight to share some information with you about SVILC and our programs and services. We're hoping that one or more services we provide for individuals with disabilities might be of interest to you or your family member who is seeking to be more independent in their lives and maybe hoping to live in their own place. Next slide, please. Silicon Valley Independent Living Center is one of over 400 centers for independent living in the country, and one of 28 centers in the state of California. All of the independent living centers provide 5 core services, which are information and referral, peer support, independent living skills training, transition services for youth seeking to transition from high school into college life or independent living, and people with disabilities wanting to move out of skilled nursing facilities or other institutional environments into community-based living. California also includes 3 more services for independent living centers: housing, personal assistance services or caregiver services, and assistive technology. SVILC is a disability peer-based community-driven organization that promotes living independently in fully inclusive communities. We have been serving Santa Clara County community for 45 years now, and Santa Clara County is home to 2 million residents. SVILC directly serves approximately 1,100 individuals with disabilities each year and provides information referral and technical assistance and education to another 4,000 residents and businesses annually. Next slide, please. So here's a bit more information about the main services that are available at Silicon Valley Independent Living Center. But first, I wanted to provide you with a little bit about our mission and more information about who we are. We are a nonprofit 501c3 non-residential organization, which serves all people with all types of disabilities, including older adults with disabling conditions and youth who live in Santa Clara County. SVILC provides residents with support tools and resources needed to live interdependently, and we advocate for policies that ensure equal access and opportunity for all. Se habla español as well. Our disability services include advocacy, which is self and community advocacy. And that's learning how to speak up for yourself and your needs and how to make changes in your community that matter most to you. Independent living skills training includes life skills that will make you more independent, such as budgeting and money management, time and personal management, cooking, shopping, emergency readiness, and more. Peer support, a safe place to come and discuss what's on your mind among peers with disabilities, and we have weekly meetings available on Zoom currently. We also provide information and referrals, as I mentioned before, which allows you to get connected with other organizations and benefits and services in our area. Personal assistant or caregiver services, teaching you how to find, hire, and manage a caregiver. Assistive technology, and that's adaptive tools or ability tools and technology that makes everyday living for everyone easier. And we have a free device lending and demonstration library as well on site. We are one of 12 device lending and demonstration centers in the state of California. We also provide housing search assistance, learning how to look and apply for affordable, accessible housing in Santa Clara County. And we have free workshops every week. Matter of fact, we provide 2 workshops every single week on housing and how to apply for housing. And then benefits services, which are learning how to, let me get here, lost my place on my slide. Learning about the various available disability benefit programs that folks might be eligible for, including Social Security income or supplemental security income, Social Security disability income, Medi-Cal, in-home supported services, CalFresh benefits, and more, and how to apply for those services. Now I'm going to turn it over to Lisa, who's going to start us off with a little bit more in-depth information about our services that we just covered briefly, starting with information referral.
Thank you, Sherry. Like Sherry was stating in the previous slide, we do offer information and referral. Our information referral coordinator keeps updated information on community-wide services, programs, and seasonal events that may best assist our consumers and their families, such as information, but not limited to food pantry, clothing closets, locating benefit enrollment offices, referrals to organizations and programs in Santa Clara County. We do offer a lot of services at our center, but just in case if we don't have one that is a best fit for you, or you're looking for something we don't offer, our information referral coordinator can definitely assist you in locating the right program for you. So if anyone is looking for a program, maybe they need their local food pantry, they're looking for maybe some online courses or how to start. We even had questions on consumers looking on how to start driving and programs that can assist them. They can go ahead and assist you with locating those certain programs. So if you have a question, you can just go ahead and call in to us for more information at 408-894-9041, extension 200, and ask for information referral, and they'll be more than happy to assist you with locating a program that you're interested in finding.
Thank you, Lisa. And Christina Mills, our colleague who's the executive director of the California Foundation for Independent Living Centers, will be speaking at the end. She also put a link in the chat to the directory to all of the independent living centers that are across the country. So in any state, you can find at least one, but probably more than one. Assistive technology. Assistive technology, or AT, may make everyday living even easier for somebody with a disability. SCLC is one of 12 device lending and demonstration centers, or DLDCs, in the state of California. A variety of items we have available in our lending library include wheelchair ramps of various sizes and types, and those are portable ramps, assisted living listening devices, smart speakers, accessible kitchenware and eating utensils, and we also even have gardening items. We also have a voice options communication tablets, which we're going to cover in just a few minutes. We have over 250 items in our device and demonstration lending library. And as I mentioned, people can try them out for free for up to 30 days. before deciding if it's a device that is going to meet your particular needs. We have items that help folks that live independently in their own homes or in the community. We also have devices that help with educational settings and work settings as well. As I mentioned, also in our device lending library, we also have Chromebooks that are available for short or long-term loan. These items help folks that don't have access to a laptop or desktop computer at home or in their work or educational setting, and stay connected with their friends, with work, to be able to join Zoom or other platforms for classes and learning opportunities. And these are available through SVILC. You can contact us at at.svilc.org to find out how you can get your own Chromebook so you can stay connected while staying safe at home. And we still have plenty of these available for members in our community. They've been a hot item, as you can imagine, for students with disabilities since the pandemic, requiring education through home systems, and also for our older adults that have been especially isolated during the past year. Also part of our assistive technology services is that we accept gently used and in good condition equipment to be donated, focusing primarily on manual wheelchairs, power wheelchairs, and scooters. We also will accept rollator walkers. We do have a strong need periodically with people contacting us and they don't have insurance coverage or they're in between being able to utilize insurance for a mobility device. And so we will see if we have something that will meet their needs and basically donate it to them. So we bring in the donation from our community and then donate it back out to somebody else in the community. And again, you can contact us at at@svilc.org or 408-894-9041 about our reuse and recycling program through assistive technology. Okay, Lisa, why don't you take the next couple of slides?
Yes, community and system change advocacy. So like we stated, we do have a community advocate on staff that can assist consumers in learning how to be a better advocate for themselves. You learn how to speak for yourself and to make changes in the community that matter most to you. Our community advocate is here to help you build your confidence and find your voice. We also conduct several civil engagement events to understand the importance of voting, participating in the census, and legislative bills that are waiting to be passed and policy changes in our local community. We also offer workshops to assist consumers in learning how to be a better advocate for yourself. We have one on advocacy in the workplace. We understand for those who are just entering into the workplace might be quite difficult. They might not know how to go about certain things, how to ask questions, how to, if there's a situation going on, they're not feeling comfortable, how to speak up for yourself. We do have a monthly workshop that is going to be on I believe the third Wednesday of the month. So you can go ahead and learn how to be a better advocate for yourself and how to advocate in the workplace in the correct manner. Our community advocate is Christine Fitzgerald. She can be reached at the same number, so 408-894-9041, extension 203. Or if you would like to get more information from us, you can go to info@svilc.org. You will see here on the right-hand side some posters and pictures of us from some advocating events. So we have here some staff members who participated in the NAMI event, SVLC Advocates for Mental Health Awareness in Santa Clara County. There is a picture of 2 of our staff members who participated in the walk. You'll also see another picture of us hosting a workshop out in the community. and also a demonstration of us protesting, going out to speak about supporting our community, how to advocate for ourselves at the City Hall. Community transitions programs. Our CTP, California Transition Program team, follows and supports individuals returning to community from a medical facility or nursing home to ensure safety and sustainability. It's a comprehensive care coordination monitoring to facilitate tailored transition services for persons with disabilities into community living settings. So basically, if someone is living in a skilled nursing facility, a nursing home, and they're needing assistance in getting back into the community, but maybe they don't have any family members or friends that can assist them, that's when we can go ahead and step in and assist them with transitioning in. So that can be a large variety of services, from helping them figure out their budgeting services, connecting them to benefits to make sure that they have enough income when they're out in the community, housing, so locating housing. If they don't have any funds to pay for new furniture, we can assist them with finding furniture, clothing, getting them started up. And once they do go into the community, we can assist them with activities of daily living. So learning some independent living skills to be more independent. Since they might have been in the nursing home for a little bit, we teach them how to cook if they need that assistance, travel training, so how they would get to their appointments, doctor's appointments, or grocery stores. We can teach them all of that skills that they would need in order to be sustainable in the community. We can provide all those services as a part of our community transition program. And in order to get connected to that program, SVLC has you would just have to contact us and we can tell you the right manner on how to apply for those programs. SVLC has transitioned approximately 250 individuals into the community-based housing of their choice since 2011. So we do assist them with locating housing and getting back into the community. On the right side, you will see two pictures of two people. One says, "My independence is my dignity." Another picture at the bottom says, "SVLC helped me get back into my real home. I can garden and paint again." These are two photos of consumers that we have helped transition them back into the community. Sometimes they already have their own housing. They just need to modify it a little bit, so we can pair them up with our assistive technology coordinator that can find the correct devices to assist them to live back in their homes, or sometimes it's just us locating new housing. Disability Disaster Access and Resource Center. This is a new program that we started hosting for all independent living centers. So SVLC is the Disability Disaster Access Resource Center, DDARC. For Santa Clara County, DDRCs work in partnership with PG&E to assist residents with access and functional needs in event of a public safety power shutoff, a PSPS. So this is when these typically happen in fall, but we're seeing that they're coming longer and longer. They're coming out in the winter. We had some of the parts in California did undergo a PSPS event in January and December just due to us not having a lot of rainfall. PG&E will declare a PSPS event if, let's say, there's high winds, high temperatures, in order to prevent fires. So they will turn off power to some consumers of theirs. So in order to better assist them in, let's say if someone is in that power outage zone, we will come in and assist those who require electricity to power any durable medical equipment or assistive technology. That can be such as a CPAP machine, refrigeration for insulin. Sometimes there's nebulizers, any type of assistive technology or durable medical equipment. We can go ahead and assist those because we do understand it's very dire if their power were to turn off and they don't have access to their equipment. What services we can provide is creating a personal and family emergency plan. So we want to go ahead and create a plan before an event happens. So how to be prepared, and so that you're not caught off guard. You already have your emergency kits ready. You have your contacts ready. You know the transportation and how you're going to get out, because emergency can arise any moment. We provide backup battery loans dependent on case by case. We can provide a backup battery to those who require it. We can transport it easily before an event to make sure that you're safe, or during an event as well. We have a variety of different sizes depending on the device that you're needing to charge. We also provide hotel vouchers. This is in case of, let's say, if someone just has too much electrical output that our battery will not be sufficient enough, we can go ahead and pair you off with the hotel voucher outside of that power outage zone. So we can give you that voucher so you can stay there for the remainder of the power shut off. Also with that is transportation voucher. So let's say if you do not have any transportation to get to that hotel, we can coordinate a ride for you as well. And that can be accessible or not, dependent on each case by case. We have food vouchers. We do understand that once a power outage happens, that means you won't have access to your fridge. That means you're not going to have any food. So we'll give you a food voucher so you can purchase food during that time. So you don't have to worry about that. Also, we do have a food pantry so we can provide you services in order to restock your food. Another service we provide a part of this Disability Disaster Access and Resource Center program is Utility Medical Baseline Application Assistance. We can assist you with applying for Medical Baseline, which is an energy saving program that PG&E has to assist those who do require electricity to power durable medical equipment or assistive technology in order to get a lower rate, because they do understand that some of these devices use quite a lot of electricity, so it's going to higher your bill. So by applying for this program, you'll help lower your bill, keep it under a cost, and we can assist you with applying for that bill and sending it in for you. All you have to do in order to get connected to this program is contact us at psps@sblc.org for more information.
Thanks, Lisa. I'll take the next couple of slides. One of the emergency services that we provide, and that we really ramped up quite extensively during the pandemic, is our food pantry services. For 30 years now, SBLC has been a partner with Second Harvest as a supplemental food site in the community. And both of our office locations, our San Jose main office on 14th and Santa Clara, as well as our branch office serving Southern County cities, is located in Gilroy. And both offices have food pantry services. We, throughout the duration of the past year, have made sure that our food pantry program has been up and running continuously. 2 days a week, people can come in by appointment and pick up a bag or more of food items. And we have a variety of items. We were able to get a grant from the county a few years ago to expand our program, which was originally non-perishable food only, so dry goods. But we were able to purchase a large capacity refrigerator freezer in order to add perishable and nutritious items to our pantry services. So some of the items included in our perishables are produce, breads, meats, and dairy products. You see a loaf of bread there is in the picture. In the center is a picture of a bag of groceries of a variety of things in it, a loaf of bread, some asparagus, some pasta, and lettuce, and some sauce. And we also have those kinds of items, dry goods, which include cereal, beans, oats, and snack items, and then canned goods such as fruits, vegetables, soups, proteins, and other items. So we keep quite a variety in our food pantry. Next slide. Other items include, and you see eggs there, baby food, personal hygiene items and beverages. So we do have items for all family members, including babies. We also have a variety of personal hygiene items, including feminine hygiene products for women, as well as adult size diapers in various sizes, like Depends, and also a variety of beverages, including water and juices. Our San Jose Pantry, as I mentioned, at our main office is open Wednesdays and Fridays, 11 a.m. to 12 p.m. by appointment only. And our Gilroy site on Church Street is Tuesdays and Thursdays from 10:30 a.m. to 12 p.m. As soon as we return back to the office more substantially next month, after the state opens more fully, then we will be able to offer our food pantry services more extensively than just the 1 hour twice a week. Would you like to take the housing services, Lisa?
Yes, housing services. So our housing coordinators provide support to those looking for housing in Santa Clara County. We host workshops on a weekly basis with updated county information. So we do understand that finding affordable and accessible housing in our county can be quite difficult. And we do know that is a big need in our community. So we offer 2 workshops every single week on Fridays, one in the morning and one in the afternoon. The morning workshop goes over Housing 101, housing basics. So basically, what's available in our county, how do you start housing, what should you start first? You need to do your budget. You need to figure out, okay, if I don't have enough income, do I need to find a roommate or should I apply for benefits as well? We can go ahead and teach you what are the first steps you should do in order to locate housing, not only in our county, but any place you would like to move to. Our second workshop, which is in the afternoons, is how to locate housing online. Because now since COVID has happened, everything has pretty much turned to online. So we go ahead and offer services on how to navigate the online housing search engine, such as Trulia, apartments.com, even Facebook Marketplace. Also with more specific programs in our county, like Santa Clara Housing Authority work pages on how to locate different properties in our county, or Go Section 8 if someone does have a Section 8 voucher. Our housing search assistance is to find stable, independent living solutions in the community. We also offer emergency rent deposit funding assistance based on funding availability. Over 400 residents served in 2020 with $600,000 in financial assistance. So dependent on certain funding resources, we might be able to assist you with paying for back rent, maybe first month's rent and deposit. It's by case basis that we can go ahead and assist someone if that's what they're in need of. Information referral assistance to independent living and the community. So like we stated previously, we are your local independent living center. We cover all Santa Clara County, but also all throughout California, there is a different independent living center that can assist you. So we can refer you to another independent living center if you're trying to move out of county or need other services. Housing advocacy to ensure that the needs of people with disabilities are being considered, and planning new housing or improvement projects. So we go ahead and our community advocate, our other staff members go ahead and advocate for our community to make sure that these new developments that are coming up are going to have affordable units for our community, and they're going to be accessible at the same time. On the picture on the right is a picture of a building. It says rent now.
Go ahead and cover ILS since this is your forte.
Yes, independent living skills. This is a program I know very well since I am one of the employees at SVILC that can assist consumers. There's my other counterpart, Jonna Spina. She can also assist consumers with independent living skills. Independent living skills, what is it? It's training to meet individual needs of people who choose to live independently. We host free workshops on budgeting, time management, emergency preparedness, cooking, and more. So we used to do workshops in person, but now due to COVID, we're hosting them over Zoom. So pretty much every single Wednesday, there's going to be a new independent living skills topic. We have emergency preparedness is on the first Wednesday, time management on the second Wednesday of the month. There is CFPB, so how to do budgeting. We also do caregiving workshops as well. So we host them every single month. And let's say you can't attend this month, don't worry, just come back the next month. They're always going to be on the same Wednesday. Independent living skill coordinators, which I am and Jonna Spina is, may also provide coaching on the following. So not only do we host workshops, we do other services. We can assist consumers with resume writing, job search skills. So how you go about applying for jobs, how to create a resume. We go ahead and assist you in learning on how to do an interview. So how you should go into that interview, dress properly, how you should talk. We can coach you on how to do any of those services. Internet safety, especially during this time, we know that going on the internet might be a little bit crazy. Some people might not know the proper sites to go onto. Make sure not to click ads. We can go ahead and teach you how to use the internet safely. Job and housing applications. So we team up with the housing department and assist consumers with applying for housing. So let's say you never applied for on a housing application, you don't know how to start. We can teach you how to fill it out correctly. And job applications, exactly the same as housing. If you never applied to an application, or let's say you don't know how to use a computer, we can teach you on how to do that to achieve your goal of applying for a job or applying for housing. Public transportation access. We do understand public transportation can be quite confusing. The VTA, BART, or even paratransit, how to get connected. We can assist you with learning the steps on how to use this transportation safely. Basic cooking skills and healthy food choices. We do host workshops on how to basic cooking skills. We used to do one every single month in person, but now we are trying to do it more over YouTube. So we're filming ourselves and teaching those how to cook. And we do have a fully accessible kitchen in our office. So once we are able to go back, we teach people and we do workshops there. In our accessible kitchen, we can also show them how to use different AT devices, assistive technology devices. If they need that, we can pair that for them in the housing workshop. In the cooking workshop, you'll see on the right side some pictures of our consumers who have attended some of our workshops. So you see that we made some fish in one picture. There is a picture of some of our consumers. We do also advocate for clean cooking habits. So wearing a apron, making sure you wear hair nets to make sure there's no hair getting into your food, proper washing of hands, food safety. We teach that all during our cooking workshops. Money management and budgeting. We do teach this. We assist them with learning new topics. So how to go ahead and create a budget for yourself. If you don't have enough income, pairing you up with programs that can assist you in expanding your budget. We are doing a wallet game. We have created this game that can assist someone in learning how to create a budget and how to basically live in the community. And youth transition services. So this can mean a variety of things, such as learning how to do money management, personal hygiene, how to speak for oneself in the job workplace, transportation. All of these are part of youth transition services. So getting someone prepared to transition into the community before they actually do so that they know the proper skills, so that when they do go out on their own, they won't be as worried or feel nervous when they do move out there because they already know the proper skills to get them there.
Thanks, Lisa. The next slide, we're almost done, is about peer support. Independent living centers are unique as disability service and advocacy organizations because we are run, governed, and facilitated by people with disabilities. So the majority of our staff, as well as board members, are persons living with a disability and have personal experience with disability. And so basically everyone who is a service provider at SVLC is able to provide some peer support and peer mentoring. But we also have more formal peer support services as well on a one-on-one basis and primarily through our groups. As Lisa mentioned earlier this evening, Christine Fitzgerald, our community advocate, also runs a peer support group called the Coffee Clatch. And every Monday, people can get together and drop in and drop out. You can commit to every single week or just come when you can and join other people with disabilities to chat about issues and things of interest. Also offering each other ideas about how to solve a particular problem or concern. So again, we know the importance of being seen and heard. We offer a safe place for people with disabilities of all types of disabilities and ages to come together and share with each other and share their ideas. And as I mentioned, every Monday on Zoom at 9:30, we have the Coffee Klatch. And to join that group or for more information, you can contact Christine at christinef@svalc.org or 408-894-9041, extension 203.
Personal assistance services. So we do have a PA department. So we have a caregiver registry is new and improved. Now you can find a caregiver who best match your needs in a flash. Our personal assistance service department locates caregivers actively seeking work on either a private pay or in-home support services basis, while creating a detailed profile of skills and availability on Quick Match database. Select your needs from the menu of the options, and our database curates a list that fits your needs perfectly. No more guesswork. In addition, our consumers now have the tools to empower and create structure when employing a caregiver. We do offer once a month workshops on Zoom that can teach you how to manage your caregiver. Sometimes people who they first get a caregiver, they don't know how to be in that boss role. So how to go ahead and advocate for themselves, how to ask for certain things in a certain way. So we do have that managing your caregiver. Also, how to start the process. If you don't know how to start the process and you're looking for a caregiver, how do you place an ad to find one? Or how do you register for in-home support services? We can assist you with that. We do offer a Quick Match, which is a database of our caregivers that we have actively looked for. We have gone through the process of interviewing them. We have added them to that registry where our consumers can then go ahead and gain access to that once we have done a pre-intake with them to see what their need is. So what days are they looking for? What services do they need? Do they want a male or female caregiver? Do they want someone that's okay with animals? We go through that pre-intake prior to them receiving access to the Quick Match database where they can locate a caregiver that fits their needs. So it can be very detailed to what city in our county, to are they private pay or IHSS caregiver, and how much they are willing to be paid as well. So that's all a part of our Quick Match database. In order to look for the service and ask for it, you will just have to contact us at quickmatch@svalc.org, or you can call us at 408-894-9041 at extension 230.
Thanks, Lisa. And lastly, as I mentioned, during the pandemic, we started providing additional services, and one of which included providing personal protective equipment, or PPE, for our consumers, for their caregivers and their family members. We still have plenty of PPE available if anybody still needs face masks, hand sanitizer, and I know the picture says latex gloves, but we have non-latex vinyl or nitrile gloves available. And we also have plenty of cloth face masks too. We had a wonderful volunteer make us about 150 cloth face masks last year. So if you're in need of any kind of personal protective equipment, we also have some face shields as well. You can contact Jana at our phone number, 894-9041, extension 230, or her email address, GIANNAS, Jana S, at svalc.org to set up an appointment to pick up the PPE that you need. The next slide was a testimonial from one of our consumers, but we'll make the slides available to you through PHP, and you can listen to that on your own if you'd like. Elizabeth talks about how she utilized such a variety of services from SVLC over the course of a year to help her move from very difficult situation and homelessness into her own housing, and also find employment, and she is now employed full-time. And lastly, the slide here is our contact information. Again, we have a San Jose main office at 25 North 14th Street, Suite 1000 in San Jose, 95112, and our Gilroy branch office serving the South County cities of San Martin, Gilroy, and Morgan Hill. And that is at 7881 Church Street, Suite C in Gilroy. Both of them are accessible by public and paratransit and have parking available. And then you can find us on Twitter, Facebook, and on the internet as well. And that ends our presentation. I know we have lots of questions to get to in a few minutes, but Christina Mills, the Executive Director of the California Foundation for the Independent Living Centers, our membership organization for the state of California, is going to share a little bit about the CILs throughout the state as well.
Thank you, Sherry. And I just want to first start by saying what an honor it is to be co-presenting with the local Independent Living Center, and you're giving me all these ideas about what we need to do on a statewide basis that we probably haven't tried out but could really benefit from providing. So again, my name is Christina Mills. I'm the Executive Director of the California Foundation for Independent Living Centers. We are the membership association for the centers across the state of California that select to be members on an annual basis. Thank you, Parents Helping Parents, and Marley, everyone at PHP, for inviting us to be a part of this evening's conversation about independent living centers, something very near and dear to my heart. I've spent over 20 years of my career in IL, and am grateful to continue to work with such wonderful people. One of the things that I really want to hone in on that Sherry and Lisa shared is something that I think is so unique that we don't talk enough about, that is incredibly beneficial to people of all ages that come to our centers for services. And that is the fact that we are led by and for individuals with disabilities. And what that means is you could have ADHD, you could have a learning disability, you could have hearing loss, vision loss, you could be a wheelchair user like myself. The range of folks that we serve is the sky is the limit. There is no limitation between age or disability. We serve many folks with autism. In fact, at our organization, we also do a lot of partnership with the Association of Self-Advocacy Network nationally. Because autism is such a popular, I will say, disability these days, we have a lot of wonderful opportunities to partner with the Association of Self-Advocacy Network to do a variety of trainings and events remotely across the country. And in fact, we just did one together last week for a health plan and teaching health plan providers how to work with people with disabilities, and specifically how to work and make medical appointments accessible to people with autism specifically. So while we are people with disabilities running these organizations, I think one of the other things that is really important to point out is that there is no age range for who can be served through an independent living center. And like Sherry said, we are not places that you live. In fact, you come to independent living centers to get everything you need to be as independent as what works for you, honestly. So whatever is you living your best life, and we all know that we all need support, regardless of disability. Humans need support. It's just a thing that we all, I think, realize in different reasons and different reasons why we all need support, but may not look at it as support because we are so self-sufficient. But just to say that independent living centers are assisting people in meeting their independent living goals, regardless if that means, in a lot of people's heads, living on your own or doing something on your own, it really means through supports and services that make your life, your quality of life, the best it can be for what you want to do in your life. And with that said, I think it's also important to hone in on two other additions. One is, like many social service organizations that are required to offer services and programs to a specific economic group, we have no parameters. We are not required to only serve low-income individuals or a specific level of income. We are permitted and really passionate about being able to serve people with disabilities at all income levels. And whether you need services because of economic reasons or not, one of the great things, like Sherry and Lisa had mentioned, is the peer support, the disaster work, all of the different services you can get that have nothing to do with your economic status. And secondly, you don't have to prove you have a disability for our services. That was something else that was really important when we were created in the late 60s, early 70s, is that you don't have to show proof of your disability. You just have to identify as a person with a disability. And one of the things I think is really important about that is statewide at CFILC, my organization, while we are the Association for Centers, our job is to build the capacity of their programs and services. So everything Lisa and Sherry went over is connected to CFILC, and we are creating the training, the network, building relationships, looking at funding opportunities to make their programs and services better for the community that they're serving. And I think what's really important to bring up is, in addition to that, we run a statewide youth program called Youth Organizing Disabled and Proud at CFILC. And one of the things I often hear youth coming through our program say is that they didn't know they had a disability. And that seems to be increasing as time goes on. And we do a lot of work to ensure that disabled youth, specifically in our program, understand that they have rights. Disabled people have rights that have been fought for and secured for some, in some cases, decades now. And we want to make sure that youth with disabilities know that as disabled youth, they have rights too. So in addition to the centers across the state and across the country, I provided the links in the chat to the directory for California centers and then the directory for centers across the nation. One of the things I just want to point out that I think oftentimes goes unnoted, but is happening without us realizing it, is that centers also offer a tremendous amount of mentorship. And we don't necessarily name it, but because we are run by people with disabilities, when youth and anybody of any age comes in for services, they're often getting mentorship from us that they wouldn't get from other places because there's not a connection to professionals with disabilities that youth specifically are often connecting with. So lots of times when I'm meeting youth, they'll say, oh my gosh, it wasn't that I needed to go to my independent living center for services. It was that I got to connect with an adult role model with a disability that was working, had a family, lived on their own, employed caregivers, all those things that we do that youth really get to see and really experience through independent living center services. So I can always come back and do a separate presentation on Yo Disabled and Proud. There are many components of it, but I think that this group tonight has some amazing questions for SVILC. So I'm going to turn it back over to PHB to go over those questions.
That is great. I am blown away by what you do. No income barriers, no barriers for people to have to prove a disability. This is just an amazing amount of resources for our families. And I'm just really so glad that we're doing this. And I would love to have you come back and do one for our youth. So, okay, I want to move into questions because we've got several. And you've answered many of them. So let me start with, okay, what forms are involved and where do we get them? Like, how do they apply?
Well, this is Sherry. The fastest way is to give us a call Monday through Friday between 9 and 12 or 1 and 5 p.m. We are closed for lunch, but we do have an answering machine. So if you do happen to call at that time, you can leave a message and we'll give you a call back. The number again is 408-894-9041. and you will be set up with the INR coordinator who will conduct an intake over the phone with you. That's why we're doing them now until we are able to go back to meeting people in person. So we'll conduct an intake over the phone and get you enrolled in services immediately. After an intake is done and your input into our system, and then we will match you with a service coordinator for your priority need. So if it's independent living skills, you would probably be referred to Lisa or Jana first. And then if there are other needs that other service coordinators can provide you with support, then we will hook you up with those service providers. But it's very simple. Just give us a call at 408-894-9041.
So Sherry, is there a waiting list, or how long does it take for people to get services?
There's no waiting list. We will have people scheduled for an intake interview within a few days to a week. Sometimes they're done immediately over the phone. It just depends upon the number of calls coming in that particular day. But certainly within a week, folks would be able to have an intake and become a consumer and then be referred to a service coordinator. If somebody says that they're interested, for example, in one of our ILS workshops that Lisa talked about, or our housing orientation workshop, then they will be immediately booked onto the next available workshop time for that and scheduled for that. So some of the services are provided almost immediately, and others then would get a phone call within a week from a service coordinator.
Great. Is there a relationship with the regional centers? Are the ILCs only a resource, or do they provide housing? That's a two-parter.
Okay, so good questions. They're all good questions. So we are not part of the regional center. We are a separate statewide a network of centers for independent living, just like the regional centers are also a network throughout the state under the Lanterman Act, provide services and supports for people with intellectual and developmental disabilities. The Centers for Independent Living are also a network of agencies that provide peer-based support and independent living skills training and advocacy for people with all types of disabilities. However, most of us work very, very closely with our local regional center. As a matter of fact, during the pandemic, we did a lot of cooperative work with SARC here, our San Andreas Regional Center, on a vaccine rollout, and also worked very closely with PHP on those events. So we do a lot of cooperative work. We refer back and forth. SVLC also is available to provide independent living skills training under self-determination. So if an individual is interested in receiving ILS training services from SVLC, you would just need to contact us and we could set up an appointment to set up a contract for those services under self-determination.
Okay, great. I'm going to ask Elena to come in and ask some of the questions that are on the Q&A. We've got a lot. So
we do. We have a few simple ones. We have a question from one of our Spanish speakers, and she is wanting to know, is the age 18 the appropriate time to connect with you, or can they begin earlier?
So we provide services for people of all ages with all types of disabilities, but obviously some services are more geared for those over the age of 18. So it just depends upon what the request is. Certainly our cooking skills class, we've had some youth. You probably saw in the pictures, some looked quite a bit younger than the age of 18 because they were. So we have middle school and high school students. We just need to get a parent's, release and approval for that, for them to participate in those classes and that training. That's the only difference. Obviously, employment services would be for those who are more adults as well. So it just depends upon the type of service, but we can serve definitely youth. That's one of the things that we do is youth transition, helping our young adults who are primarily high school age get ready to transition into adulthood.
This is Christine. I was just going to add, Sherry's assisting one of our friends in navigating their family member through the Department of Rehabilitation Services right now to ensure that that youth also gets the Department of Rehab post-secondary education resources that they provide as well. So that type of in-depth, not only information referral, but also training on how to go through that system is really important and incredibly helpful. Lots of families are not connected to Department of Rehab and don't know that youth services are an option.
Do the independent living centers work with high schools for transition age kids in terms of setting up their goals and plans for when they leave the education system?
Hi, this is
Absolutely. Lisa, you've done a lot of that.
Yes, definitely. We do. Prior to COVID, we did host a lot of workshops with post-secondary going and do independent living skills. We worked with SELPA. We worked with a bunch of different school districts, Fremont Union, where we hosted weekly workshops during the summer at De Anza College, I believe. And we also did that on Zoom as well. Since everything transitioned, we do offer that through Zoom. So we do offer weekly web classes for those post-secondary students or transitioning.
Great.
Just wanted to mention, Marley, on an in-depth one-on-one basis, though, is that would be something if the individual is part of the regional center would be under the self-determination, and so we would establish contracted services for that.
We have many people that I encourage to attend tonight that are from some of our support groups for things like fetal alcohol or mental health, where they're not part of the regional center system, really are feeling like, there are no resources for them. That's how they feel. And I encourage them to come because I said, this is an appropriate resource for you.
Absolutely. Absolutely. One does not have to be part of the regional center. We know a lot of people are not. And so that being the case is that we would work with them, independently, as depending upon what the needs are, to set up a transition plan and goals and get involved in activities, either training that we provide on site or that's available in the community, or a combination of the two.
Great. I think most people have come here because through us, they're thinking about their kids, but because you serve all ages, I've got a question. Do we have any council on aging in our area? If so, do you work in conjunction with them or overlap?
So the AAA, or Area Agency on Aging, is SourceWise. They used to be called Council on Aging. That was their old name. And a number of years ago, they rebranded and named themselves SourceWise. So yes, we do have a AAA in Santa Clara County. They provide a variety of different services and supports. They assist with the public authority matching for in-home supported services. They run that program. They're the high cap provider, Meals on Wheels, a variety of services primarily for older adults, obviously because they're the AAA for the area. But we do coordinate with them for a number of different programs and services as well, and we refer back and forth.
Elena, what have you got? I know we're both scanning for.
We were both looking. There are a lot of really good questions, but I'm looking at there is a little bit of confusion on how connected your services are with regional center. One question specifically is they believe that if you are not a regional center, then you would not be able to assist them, or sort of how do you work together with regional center? Do they go to them first and then you're second, or do they sort of how do they assemble this together to get the best?
Sure. So there's no one way of doing anything. If somebody qualifies for regional center services, I would certainly recommend that you apply or have your family member apply for their services. because it opens up the door for many more opportunities for funding for them, not only for independent living skills training, but also for supportive housing services, for supportive living services, if that's what they need for a period of time in their life so that they can become more independent or interdependent. So definitely would look into applying for regional center services because like I said, that opens up a real breadth of different kinds of supports and services that one can receive. However, not everybody is eligible or interested in regional center services. And so you can come to SVLC for the services that we offer at any time, or, you know, even sometimes do both. We've had folks that are not part of, before self-determination came into effect, we were vendorized for community living services, so community integration services is what they were calling it. So they were utilizing the regional center and one of their providers for one-on-one independent living skills training, and utilizing SVLC for the community integration training, or for assistive technology, one of the other services that we were vendorized for. So you can do a combination of things in order to have the most opportunities for services and supports.
Thank you.
I think this is a good question. Because it's independent living skills and we're talking about independent living, right? What about group home situations where somebody's feeling like, you know, they're not going to be independent in their own apartment, but maybe in a group setting? Do you work with those folks too?
Yeah, so we don't dictate the living arrangements that people are in or choose to make. What we do is help them in the environment that they are in or that they choose to be in. And so sometimes people are living on their own. Sometimes they're living with a caregiver or family member. Sometimes people are living in as you said, a group home or RCF situation. And so we will work with them, whatever their environment is, and helping them be the most successful and independent as they can within that living situation. Absolutely.
No, housing and transportation are two big ones for you. There's a question about public transportation and if you can help obtain a discount for VTA in San Jose.
So VTA does have discounts for certain different groups of people who use public transportation, and they do have a youth pass. It's a monthly pass, and there is a discount for that. We can certainly show you how, or the individual, how to apply for that youth discount on the public transportation through Santa Clara County VTA.
Okay. I think we've answered this, but we should just make sure everyone hears it loud and clear. The question is, how old do people need to be to enroll in this program? And you've said several times now, any age,
yes.
right?
Any age, any age.
And also, this is from any country. Is that was the second question? Do they have to be born here in the United States?
Oh, good question. No, not at all. And you do not have to be a citizen or legal resident or anything. We do not ask for any of that information at all.
If I may ask one question, there's several questions about where to find your trainings, and they vary either if it is an adult who wants the very specific life skills, and then there are other trainings they're asking about that are more sort of like money management and employment, and they're looking to see where they can find this information. Do you have this on your website and your calendar of your trainings? Where can they find this?
Yes, I'm going to go ahead and let Lisa answer that, because the best way or easiest way to find the specifics on that would be on our workshop page on our website.
Excellent.
Yes, definitely. We do have our workshops on SVLC /workshops. So you can locate all our workshops on that website. Like I stated before, all our independent living skills workshops are every single Wednesday. So we have workshops on time management, emergency preparedness, budgeting, we have all those workshops available on our website. So on Zoom, we can go ahead and provide them. Let's say if someone's asking for a very specific independent living skills that we don't offer as a group workshop, we can go ahead and do that individually. All they would have to do is contact us, start the process of the intake, and then our intake coordinator will refer them to the independent living skills department, and we can assist them with that.
And if I'm not mistaken, our workshops are also posted on the PHP
Yes.
Yes, you
calendar as well.
We're
Marley?
putting them on our calendar.
Yeah. Okay.
Yeah, okay, so it's 8:08. Wow, we have a lot of questions. I'm afraid we aren't going to get to all of them, but Parents Helping Parents and Silicon Valley Independent Living Center do take questions. So please follow up with either of us, and we can help you get answers to anything that we didn't have a chance to answer tonight. Okay, well, I am just going to say I am blown away. Thank you for your time tonight and all this information, Sherry, Lisa, and Christina. It was so useful and much needed. We hope this has been good information for you and your family. We wish everyone the best. Good night,
Thank
everybody.
you. Good
Please
night.
be sure to contact us, and we will answer all of your questions.